Mine is brand new, and I just literally put it on. If you want to use it, I don't need to.
Oh, it's okay. They might have one inside. I've had that happen before.
Let's have masks. You know what? You guys have any masks?
Yeah.
We've kind of taken a two-pronged approach. Staff screening, it's pretty simple. It looks like this. Every 2 weeks, our staff are able to come in, grab a vault kit, take it home. They either can log in on Zoom from their office here, from home, take it home, do their saliva test, bring it back the next day, drop it off here, staff take it in. Super simple, great way to screen just because we are in a higher risk environment working with kids. So that started last week. Right now we're on an every 2-week rotation, looking at possibly increasing it every week if it's something we feel staff would appreciate. Yesterday we rolled out, or no, I'm sorry, Monday. We rolled out our Buy Next Now test kits.
These are the winners.
This was a huge resource that was provided to us, through multiple agencies, the state, the Department of Education. So anytime we have a student who is symptomatic right now, they can get sent home with one of these. They're able to test at home. They get results in 15 minutes. Parents can text us or email us the results. So if their kiddo is negative, they're hopefully back in school next day or soon after. Another piece we're looking at is how can we get this into the hands of more families, members of our community. So looking at using some of the funds allocated to us to increase a YouTube video as a how-to. There's instructions, it's in multiple languages, so really trying to remove as many barriers as possible so that our families, our students can get tested as quickly as possible and get back into the classroom.
Have you been testing since it first became available last year?
Yes. So I can't remember exactly when we rolled out staff testing, but we did start with the every other week vault saliva testing on site, where staff did their testing in the buildings, overseen by the nurses. And then in the spring, we also had the vault tests available for our secondary students, which was pretty late spring. And those are now all the kits that have been turned into a Zoom kit that became what is our staff testing program.
So this just takes less staff. It's easier to do now.
Yes, and now everybody can just do it in the comfort of their own home. They hop on Zoom like many of us have become accustomed to doing, spit in the tube, wrap it back up, and then they don't even have to take it to the UPS store. They just bring it back to work with them, and we take care of that piece as well.
Are you getting uptake from the teachers that is pretty heavy?
I think our first week, we had a pretty good turnout. I want to say we had maybe 65 tests grabbed. A couple, for various reasons couldn't get on Zoom or had another something come up, but I think we had 52 that were submitted, which is great for a first week. It's totally optional. And so I think if we continue to see staff be interested, I'd like to do it every week, because we do have staff who, for whatever reason, the week that we did it, they're not available, they weren't here that day, didn't grab a test, whatever. So I think that's one of the pieces we're looking at, because it's so low impact as far as what work we have to put into it, and we have quite a few tests.
Great. Will you take as many as you can get?
Yes, 100%. Like I said, if we can get more of these, the Buy Next Nows, and I can share them again. So if we have a positive student, if we can give those to every family member so that they're able to all screen, then we know, and we're hopefully containing things a little bit better, so we're not seeing as much spread.
And as we were speaking coming in here, and I talked to principal and superintendent, all of this is with the simple goal of keeping students, staff in the classroom.
100%.
That's what it's about.
Absolutely. I can't tell you how happy everyone felt coming in those first few days of school. Like, the energy in the building is so different when you have all your kids here. I mean, even having, hybrid and everything we did last year, it was great, but you knew it didn't feel the same. And so seeing the kids even like walking out, getting ready to greet you all, and the kids are all walking to lunch and they're so excited and they want to be here as much as we want them to be here.
That's right. And this helps keep them there.
100%.
So what happens when we get a positive test?
So we have a contact tracing team in place. We have a system here where our nurses submit a form, our contact tracing nurse, make sure that we have all the pieces covered. We send out a general notification letter to classroom contacts. That student then kind of goes through the protocols. We make sure that they are, they're in isolation for 10 days. We get them connected so that they're still maintaining connections to the school building. And then we just make sure that we don't have any other concerns within the building. We're always monitoring, to make sure that we don't have spread. Do we have a couple cases in a classroom, and are we concerned that maybe we see COVID spreading, or do we have, spread amongst a small group of staff in a building? So
This testing helps you wall that off. A year
100%,
ago,
yes.
when we didn't have the testing, that meant the whole building in many cases, or at least the
Oh,
classroom
yeah.
was gone.
We're not having to shut down classrooms
Correct.
right now. We're not having to shut down buildings.
And it's stopping spread.
Right, we're absolutely seeing.
Have you had students go through a positive test, a quarantine, and then back in the building?
Not with these yet, but yes, throughout the year we have. Yep, so I think we've seen at least 3 that I know of. We started Monday, come back positive. So, and parents were just so glad that they got it right
Yeah,
then.
well,
They're
then
not
they
having
can-
to wait.
Then they can do PCR. Commissioner Malcolm will talk about
Yep.
this. Obviously, the PCR test, the accuracy is a little higher.
Absolutely.
But with the Binox now, it gives you that immediate.
It's a
And I
jumping
think-
off point.
And we should recognize it does give false negatives sometimes. So there's multiple layers
Right.
to do this. But and we have been speaking about this, just the habit of testing and understanding it and the ease of this, because I've got a freshman in high school and we've used this,
Yep.
who I can barely get to tie his shoes, and he'll do this because it's easy, he knows, and he gets it, and that means
Yep.
that sports go on. and other things
100%.
continue
My
to
freshman
happen.
is that's exactly the same feeling. So.
Yes.
And that's something too that we're tracking. When we're getting a result back from a student, was the result from a Binax now? Was it from a PCR? So that we can continue to look at our results over time, and is this the most reliable? Do we need to change the method that we're using these? Do we need to change our protocols within the district? So.
What advice would you give other schools who aren't sure yet, who aren't taking us up on the idea of using these?
It's not as cumbersome as it feels. I think that's one of the challenges that school health is feeling, is that we've done so much. So much has happened over the last 19 months. And it always feels kind of like one more piece.
Yep.
But it's really helpful. And the family response, getting so much positive feedback in 3 days, was like, okay, the hard work is worth it. It keeps our kids here. It helps us know that they're healthy. And this really wasn't a lot of work. A lot of this was done for us. I mean, Vault gave us the instructions for staff. This comes with everything you need in it. And I think, too, there's such a great community now amongst school nurses that we can share the information. Nobody has to create this from the ground up. If people want to see what other districts are doing, all you have to do is ask.
Yeah.
I would gladly share the pieces that we're doing, so that, it's that much easier for another
Yeah, you
district to
probably showed
implement.
them. Well, I don't want you to waste one of your tests, but just to show people how simple it is to pull it open, put the 6 drops in, do the swab right in the part of the nose.
Yep.
and
You
they
have
get
it down, the
both
6
sides.
drops
So-
and everything. You've
But
clearly
I
done
know
that
the
a time or
routine, you put
two.
it in. It's just just the simplicity of this. And I think the reason is obviously the Lieutenant Governor's in the same boat, where we have children in school, and as teachers and as parents, keeping that child in school is a top priority. Keeping them safe and protecting others is a priority.
Right.
This testing is a real key, and I also want to thank District 622. The masking, there's enough data behind it, and I know some of the challenges that come out of that, but it is a simple public health initiative that works, and what we're seeing is buildings that are doing their testing and doing the masking are keeping kids in school.
Yep.
It's that simple.
Absolutely.
So we're really grateful for that. I think when we go out there, we'll talk a little bit about, we spoke to the White House last week about some of the initiatives happening here, some of the things we need from them. And I think your point, Lieutenant Governor and I have spoken personally on this with this, how excited parents are about the chance to
Absolutely.
get this and take it home, and they're echoing that sentiment.
That's
to
right.
us. So-
My kiddo had a little headache and other symptoms at school, and we got the Binax test, took it right away. Relief,
Yep.
and the turnaround is so fast, so we're so grateful for it.
Absolutely, and I think families, have come to trust their schools and their school health offices, so knowing that your school nurse is saying, you can use this is going to be okay,
Yep.
I'm here as a resource if you need help, I think families, that means something.
Yep, and folks want to
them.
know. And Commissioner Malcolm will talk about this. It's the nature of where we're at now with a large number of older people vaccinated. This is hitting younger people. We had, unfortunately, 2 deaths in those under 30 today, and we're still reporting 40 deaths in Minnesota. This is far from over, but we have an opportunity here to protect our schools, protect our little ones. It has been a source of spread just because it's congregate work facility. So this is going to be important, and then over the horizon we have the possibilities for vaccinations in our elementary school.
Can't wait.
So it'll be a big deal. It'll be a big deal. Well, let's go out and talk.
Excellent. Sounds good.
Perfect. Thank you. I've been telling you it's not. It actually is easy
Not at this point.
This is our building under construction.
Thank you.
Yeah, it's right.
I know. I wish we could reel them in a little bit more. It's an exciting time to be in the field. Challenging time, but
Very challenging,
but
and
it's
so
exciting.
important. You're
Yeah.
making such a difference.
Well, I think to get us to the next phase and get our kids back to a real sense of normal, these are the steps we have to take. And
Yeah. Well, the fact that, as you said, you're that trusted health resource right here in the school
absolutely.
is so important.
And we are very lucky in every building in LTN or an RN. We've got 10 PSNs in the district. So, yeah, we are.
You guys are just doing all right.
We hope. We try to be great. Oh, okay. How was it? It does. So we have a perfect day.
It does look like that.
Kelly, last name is Kelly with a Y.
And then Senator Uyghur.
Very good.
Senator Uyghur.
Yep, exactly. Title is Health Services Supervisor.
Yes, Kelly. Yep.
You want to follow Jan?
Thank you, Kelly. Very good.
Let's call him up. You want to?
Are you ready? Yeah.
Well, good afternoon, everyone, and thank you all for coming out to this incredible elementary school at Carver Elementary in District 622. I want to thank Superintendent Osorio once again. We've worked together on many issues during COVID. I appreciate that. Principal Abramson, thank you. It's an incredible building, incredible energy with folks in there. And then the expert in this for today, Kelly Ide, is going to talk to you a little bit too for health services out here. We're here today to highlight the steps that we can take. And again, it's a very simple principle and a goal amongst everyone in that building and everyone in our administration is to keep students and staff in schools learning and enjoying and doing the things they need to do and keep them safe from COVID. And those things are not mutually exclusive. It can be done. We've learned a lot in the last 18 months. One of the key pieces of that is making sure we're tracking an early detection of when a COVID infection has happened, and that is with testing. And if some of you recall, this was a big deal. We were told in March of 2020 by the federal government that anybody who wanted to test could get one, except there weren't any. And then they said, you're on your own. We here in Minnesota did what I considered an incredible work of a public-private partnership at the time when we said we're going to be responsible. Remember the big thing then is someday we're going to be able to test over 5,000 people in a day. We were doing that in half an hour, but the capacity that we have. The capacity in the first in its nation's testing in schools has been highlighted by the federal government and has been replicated in many other states. It's because it works. If we can isolate and find out cases right away, not only can we protect the health of that individual child or staff member, we can keep the building in place without having to isolate the entire building and send folks home. That is an incredible advantage for us, but it only works if we use the testing, whether that is individual PCR testing, whether it's pooled PCR testing, or the thing we're talking about here in Commissioner Commissioner Malcolm will talk about it, the instant rapid tests that you heard a little bit about inside. The thing about those is because it's so easy to get to people, it can be done at home. Certainly the Volt saliva test works, but you have to wait usually overnight to get the results. The tests we're talking about in the rapid tests are 15 minutes. It's peace of mind, and what we have found is the psychology of being able to test in your own home and get results in almost instantly, more people will do it. And when more people will do it, we get better results on that. Last week I spoke to the White House, Jeff Zients, who's in charge of the federal government's COVID response, and highlighted that we need more of these. There's a shortage across the country. Minnesota is better prepared. We were on the front end of this. Many states don't have access to this in their schools where we do have these Binox tests. We're out here, and what I told them is that this is what they need to focus on. And I'm glad to say over the last couple of days we've seen some announcements from the White House. They've accelerated the production using the Defense Production Act to accelerate rapid testing, and they're adding more online to be able to get those. That's going to make a big difference. They've talked about, I believe, tripling production by the end of the year, which will start to be, and as you heard Ms. Hyde talk about in here, the real goal on this is if somebody asks for a test, give them one, whoever it is, and take them home. That's the whole goal. We have capacity to test in some of the sites that are still out there. You can go, of course, to your local pharmacy or your doctor's office, but that's disruptive. We're trying to learn how to live with COVID, and one of the things is if your student can take home a test, and what I just have to say I love about this, and we're highlighting this district's approach, was sending some home for the rest of the family. Now we're starting to get containment on this. We're starting to get the tracing. We're starting to figure out how that's done. And so I'm just going to make the plug here and encourage, these are available, and the state's support for doing exactly what they're doing here at Carver Elementary is available across the state. I would ask all schools, school districts, we have school board members here who I can't tell you how grateful I am for the partnership and the work that you're doing. I'm encouraging them to ask and take us up on this, continue to pump more in there. We want to get to the point where, again, as I said, it's as simple as asking for in your building and take those home, put them in the backpack, send them home with the students, and you'll have a call back from them instantly. Those are things that will work. So this is a plan that is keeping kids in school. We're seeing that districts that use the testing and then use other mitigation measures, like you see in this district with masking inside the building, are having an impact on keeping students in the building. This works. It works. It's hard in some buildings, I understand, to do the 6 feet or to do the separation or the ventilation in some of those. But what we know is the two most effective things that we can do, especially for our kids on this, is get them tested early and wear the mask. And of course, the single most important thing we can do is continue to take the vaccines as we prepare for what I think will be an early November authorization for the 5 to 11-year-olds on the Pfizer vaccine. All of those things are positive advancements. But here we are in the first week of October. Students are still in this building, still learning, still doing what they need to do. That is an incredible achievement. It takes work, and it kind of highlights that sense of this is how you live smartly with the COVID virus until we figure out and get more and more of our people vaccinated. So this is personal for me with a freshman in the St. Paul district. It's personal for the lieutenant governor with a little one who is not yet eligible to be vaccinated. And the peace of mind that comes with knowing, and you'll hear the lieutenant governor talk about this, parents just want to know if their kids have COVID or not. They want to make sure they're not spreading it to their classmates, and they want to make sure they can get the care. And Jan will highlight this. We have children in ICU intensive care with COVID. That is unacceptable. That is unacceptable. We have a vaccine, and we have the means to be able to stop this, and I encourage everyone to just, those kids should be in this building, not in a hospital bed, with a disease that can be prevented with what we have now, or at least the mitigation can reduce the risk greatly. It's unacceptable that we have only 2 ICU beds, pediatric ICU beds available last week. We need to make sure we're continuing to push to get through this, and this district has done exactly that. So I'm really grateful for that, and with that, Lieutenant Governor.
Well, good afternoon, everybody. Thank you so much to the folks at Carver Elementary for welcoming us here. For our school board members, I'm a recovering school board member. Thank you for the work that you do every single day. And today was picture day in our house, and so I sent my daughter off in a white dress, which might have been a huge mistake, but I will let you know by the end of the day. But every day when we get ready for school, it is brush hair, brush teeth, make sure you have your mask before we get in the car. And I know that that is the same thing that many families across the state of Minnesota are doing. The last school year that we had with our daughter, who's now in 3rd grade, that was untouched by COVID-19 was kindergarten. So we know that things look different in our state, and we know that there are things that we have to do. Clearly making sure that if you are eligible to get vaccinated, to get vaccinated. For those kiddos who are under 12 who can't yet be there, I have an 8-year-old who will be at the front of the line running to get vaccinated because she's so excited about it. But those are the things that we can do. Masking, the good public health practices that are happening here at the school, and of course making sure that folks have access to testing. My kiddo is not feeling so hot the other day. She went down to the nurse's office. They sent us home with the Binax test. It was super easy to do that swab, and we had peace of mind within 15 minutes. That is what we want for families all across the state as we are working to make sure that we can come out on the other side of this pandemic. And it's our job to make sure that we are demonstrating in every way that we can to our young people how to be a good relative, how to be a good classmate, how to be a good member of the community. And these are the ways that we can do those things. So please remember that we are modeling for our kiddos every single day how to take care of each other. They're doing that work here at Carver Elementary. By expanding access to testing, we can do the same thing here too. So the school year looks a little bit different than it has in the past, but my hope is that with these mitigation strategies, we will be able to get back to a more normal year for our kiddos, for our parents, and for our teachers. And someone who's been really instrumental in helping us to do that work is Commissioner Mueller. Commissioner?
Thank you, Lieutenant Governor. Good afternoon, everyone. And I'd like to echo the thank you very much, Superintendent Osorio, for allowing us to be here. Thank you very much for making sure that we're all safe and healthy in this school. And we just really appreciate all that you all have done. As you've heard from both the Governor and Lieutenant Governor, being in school is the most important thing for our students. We've said this since the beginning of the pandemic when we first came out with a safe learning plan that people were waiting for last year. We want to make sure that first and foremost our students are safe, healthy, and well, and so are their families and so are our staff. And we know that the best ways to do that is to ensure that we have a multiple layered mitigation strategies. First and foremost is vaccines, making sure that if you are able to have a vaccine, you are participating and you are taking the vaccine. Second is make sure that you wear your mask. The third is to make sure that you are physical distancing, if at all possible, and then it's testing. It's not necessarily one or the other. There are multiple opportunities to do that. And as a state, as the governor laid out, is that we were one of the first in the nation, if not the first in the nation, to lay out an in-school testing model. And that means that not only were we able to do that throughout the year last year, but we are able to do that this year. There are 2 different ways for our schools to be able to have access. One is that any school across the state can have access to tests. Any school if they want. They just need to let us know and we will send them that. If they need help with logistics, if they need any help with making sure that we are getting them everything that they need, we have the people in place to be able to do that. The second is to apply for a grant. And we know that we have schools across the state, school districts across the state who have applied to do that. We have on our website information about what school districts have chosen to participate. And that grant gives you the opportunity to expand the number of staff or personnel to be able to help to deploy a testing program, to be able to help to identify logistical pieces and to do all of this work. And so we know that we need to not only give ideas about how we're going to keep our students safe, but we need to then have the logistical means behind that. And I've deeply appreciated the work and our partnership with Commissioner Malcolm, the Governor and Lieutenant Governor, and making sure that not only have we thought about what our schools can do, but we've thought about how we can support them in doing that. I think that as you think about our students, where they want to be is in schools. What we value most about our schools is not only are they going to have a rigorous and high quality education, but it's a place where a lot of our students have access to food, mental health and physical health care and support. They have access to people who love and care about them because they are their educators and their teachers in their classrooms. And so we need them to be here. Anytime that we don't have students in our building, it means that we have students who do not have access to those really important pieces of the rest of their livelihood. And so as we think about our students who are coming in, there is no public blame or shame in testing. There is no public blame or shame in being identified as having a positive case and needing to quarantine. We're thankful. We're thankful that you've identified you're not feeling well. We're thankful that you've chosen to take a test and that you are quarantining and staying home. We appreciate the fact that you're willing to do that, and there is no blame and shame identified with that. There's a lot of pieces out there right now on TikTok that are having kids do dangerous things in schools that are aggressive. And what we're actually asking is that let's change the narrative about what our students are really about. Our students are actually about keeping our families and our communities and their peers safe. So we should really be talking about TikTok challenges that bring about wearing face masks and bring about testing. Like, that's the actual challenge. And so we just are thankful that we have the opportunity to be here today, that you all have the means to be able to do this work on behalf of our students and families. And we are deeply grateful for our partnership with Commissioner Malcolm.
Thank you. I love following the governor, the lieutenant governor, and Commissioner Mueller, who all have become public health experts in their own right. Seriously, they've covered all the key points. I just want to add a couple of things. We're here today specifically focusing on the role of testing in keeping kids safe, and just I want to repeat something Commissioner Mueller just said. Often this gets posed as a choice between protecting health and having kids in school. It's quite the opposite. It's so important, for all the reasons Commissioner Mueller just said, that kids be in school. We know that schooling and educational attainment is one of the absolute top predictors of health status over a lifetime. So it really, really matters to have kids in school, as well as the specific kind of wraparound services that are available to so many who really need them. So just to, I hope that we can, continue in this dialogue and help our school leaders, and thank you to these courageous school leaders here, because we know these are not easy decisions always for local officials to make, especially when there's so much misinformation out there still about are masks safe, does testing work, is COVID really that serious? There continues to just be a lot of things out in the community that we need to keep working hard to address and to respond to the questions that people have, but to do it with now a whole heck of a lot more data on what works, and to really support the leaders who are making these important decisions. And the testing program here is absolutely first rate, and they're also doing all the right things to help educate parents on how to use the tests and what to do. I mean, these rapid tests are particularly good for symptomatic kids. So it's not necessarily the test you would turn to just to take one every day just because. But it's really good for examples like the lieutenant governor gave of a really quick assessment of a child with symptoms, make sure that child is safe, but then to not have to quarantine, the whole class. I mean, that is one of the really solid pieces of this, that the whole goal is to keep as many kids in the classroom as possible. We absolutely need for schools and parents to use the test results appropriately, and if you've got a positive with a rapid test, we do advise getting a confirming test with a PCR to make sure it's really a positive. But then it's so important to act on what the test says. Not to say, well, it's positive, but I don't think the kid is that sick, so I'm going to send them to school anyway. That's where we really rely on the trusted voice of the health experts in the schools, and just an opportunity for me to say a thank you not only to Kelly and her colleagues, but to school nurses and school health staff around the state who are another group of frontline heroes that are doing some vitally important work right now. Just a quick word on masking, which again, as others have talked about, the layered strategies are so important. There was a report put out by CDC just within the last week that shows that schools who have a universal masking policy are 3.5 times less likely to have an outbreak in their school. So it's a really, really valuable adjunct to the vaccination and the testing strategies. So thank you for letting us visit today and take away this clear example of what works and how possible this is for all of our schools to be following this great example. So thank you for having us here today. Senator Chuck Wiggins.
Thank you, Commissioner. I'm Chuck Wiggins from Maplewood, State Senator, ranking minority member for the Senate Education Committee. Prior to becoming a senator, I served on the school board out here for almost 20 years. Well, thank you. And the Nancy Livingston, who's here as a school board member, the others, the administration, you're showing us how you can win the battle against the pandemic. And the message of student safety, staff safety first, is our total priority. And the administration has responded by providing tools, by providing equipment. That's how you fight a war. And the results, you can see it. Hundreds of students now are going to have additional hope as they hopefully can chart through this school year. It provides inspiration for others throughout the state. The nearly 900,000 or so students that are in schools and to others that are impacted. So congratulations on a job well done. We have a lot more to go, but you are showing that we will end this battle, and by taking the steps that have been outlined, that is the prescription, and that's how we're going to win. So congratulations, and now we're going to hear from the real expert, in addition to Commissioner Malcolm, and that would be Nurse Kelly Ide.
Thank you, Senator Uyghur. Thank you, Governor, Lieutenant Governor, and Commissioners for being here today. We're really excited to be involved. COVID has become very personal. Like the Lieutenant Governor said, it's really personal. I have 2 kids. I'm so excited to have them back in school this year, and knowing that we have these added resources for families is huge, not only for my own family, but for the families in this district. One of the reasons we felt as a team we wanted to implement using the Buy Next Now test kits was really to get more resources out to our families and remove as many barriers as possible. So like everyone before me has said, we can get our kids back into school safely, they're healthy, they're learning, they're in a place where they're comfortable, and where they're supposed to be as kids. They're meant to be in school. They're not meant to be home behind a screen. If we can do something to keep them in these buildings, that's absolutely what we want to do. I just have to say the nurses in this district have been instrumental in making all of this possible. It's been a team approach from the beginning of the pandemic to those first days when we found out we were going to be in distance learning up until today. They have been a great team. We've had excellent support from Superintendent Osorio all the way down. It's a team approach from top to bottom. So I don't necessarily need to repeat everything we already talked about, but we have, like I said, we have staff testing here every 2 weeks. We've got our Buy Next Now test kits available to our symptomatic students, and our goal is to expand on that with the resources provided by the state, by the Department of Education, so that at some point we can get a test, a rapid test into every family's hands when they need one, so that our kids are back in school, our parents can be back at work, they can be out in the community participating in activities, doing the things that they love, and doing it safely until we all have access to the vaccine.
Can you say your name and spell it for us and your title?
Yep. First name is Kelly with a Y. Last name's A-Y-D, and I'm the Health Services Supervisor for Independent School District 622.
Thanks, Kelly. Again, thank yous all around. This is to highlight what can work. We are at a new phase in how we fight this virus. The virus continues to adapt and evolve. This is a lot different fight than we had last year for several reasons. One is the Delta variant is not the Alpha variant. It's much more contagious and it causes much more serious disease in certain folks. But we're also at a different place, too, on what we've learned. We now have a vaccine that is almost foolproof in preventing death, Matt. So when I hear 40 deaths every day, the vaccine, the vaccine, the vaccine. We also know what does work in terms of masking, testing. We also know that we don't have to isolate entire buildings if we're able to capture this early enough and we can keep folks in. It's evolving that plan and continuing to fight this fight, but we need everyone to participate in this. I need all our school buildings to participate. We know that the buildings are at the forefront of the fight, the districts are leading the charge, and the state is here to support and provide all of the guidance and supplies that we need. Chuck described it as a battle for it, and that's exactly right. That supply chain is there waiting. We just need to implement that and put it in. We've made it clear to the federal government that they are going to have to, and they have committed this week to doing so, ramping up these rapid tests because other states are figuring out what we knew early. This is the key to winning this thing, and it's the key. When the CDC report came out, we knew that that's exactly what we were going to see. Your chances of keeping in school and keeping COVID out goes way up if you're masked. It goes up way up if you have most people vaccinated, and you also are able to stop a spread faster with testing. So we're encouraged by this. It's exciting. It's a new time. We will get this done, but we're going to need some help. With that, some questions.
Governor, I imagine you're not surprised by the Republican reaction to your suggestions about mandatory vaccines among teachers and staff and more masking requirements in schools. Your reaction to their
Well, they've done nothing since the beginning of this. They've not helped me fight this thing. I've laid out, and I just want to be clear, the suggestions that I sent to the legislature, I don't sit around planning up things to try and irritate the legislature. These came to me from long-term care facilities, from schools, from hospitals. If each one of these legislatures walks in to their local hospital, their local long-term care facility, I was on with all the leaders' long-term care facility, 5 of the 7 suggestions I sent over there directly came from them of asking me to do this to protect our seniors. So here's what I would respond, and I think this is what Minnesotans should ask. I get it. You don't like this plan. What is yours? Doing nothing kills people. Doing nothing shuts down buildings. Doing nothing avoids the science that we have. So I asked to be partners in this, and when we made the case and they were very clear they want to be a co-equal branch, then do your work. Then do your work. We need these tools. We need these tools, especially some of the waivers in long-term care, to be able to get this done. They need to be out there figuring out, how do we get more testing? How do we do these things? Setting back and criticizing is not the Minnesota way. Setting back and doing nothing is not the Minnesota way. So I am open to any suggestions that would come out of that, but I did not see that, Tom, but I'm willing to bet. Was there any alternative that was put forward?
No, not to my
Okay.
knowledge.
When there is, I'm here to listen, because we learn, we listen. We're out here to hear what these folks tell us. And if they say, you know what you need to do, Governor, we need more of these Binox Now tests, you need them now. And we heard that the last couple of weeks. We called the White House. They're using the Defense Production Act, and we're going to have more of them for you.
Governor, you're in a different spot now, having to ask the legislature to implement some of these policies that you want, whereas before under the peacetime emergency, you had more power to do that. Do you envision any scenario in which you declare another peacetime emergency?
Well, not at this point, but I really still believe, and this is what I need Minnesotans to ask. This, again, this list of requests that was sent over, it was phrased as the governor is moving the goalposts or doing something like that. The Delta variant's here. We know what works, and I asked them to give us a waiver to have more hospital beds because we're reaching capacity. That is a very simple, logical, straightforward place. I still believe there's an opportunity for us to work together on this. We could do that, but the whole use of Chapter 12 authority and the emergency response is if you needed to act quickly, you need to. At this point in time, we're still able to manage this. We're still able to do it. It's just that by not doing some of these things, they make it harder. They make it harder for us to provide the resources to the schools. We're doing everything we can. I feel confident at this point in time with the help, and especially with the Defense Production Act upping these, that on the testing front, we're going to be able to manage this. But some of those waivers and some of those things they need to do, we need to have them move. We have a shortage of healthcare folks. We know that there are healthcare folks, especially on our border states, that might be able to come across the border and help in our hospitals. We used that for 16 months under the authority that I had. I no longer have that. I'm just asking them to put it into statute for now, through the legislature, to allow a nurse or a doctor who might be in Sioux Falls to come across and work in Worthington, if that's what we need to do. That's pretty simple. Doesn't seem to be very politically a problem with it, but again, I'm hearing a full-out rejection of this. Once again, denying COVID's not going to fix it. I know it's horrible to wear masks. I know it's horrible to have to take these tests. I wish we didn't have to do all the things that we do, but that's not what leadership looks like. Leadership looks like taking on the problem as it's presented to you, finding fixable solutions. This building's done it. Those kids are in there learning, and they are about as safe as we can make them. In about 3 weeks, we can make them a lot safer when we're going to be able to get the vaccine to them, and that's going to be a game changer.
Governor, I have a question for Commissioner Malcolm. You touched on this, Commissioner, related to these rapid tests are very good for symptomatic people, maybe not for a daily screening. Can you lay out how the rapid test should be seen in conjunction with the PCR tests? Lieutenant Governor Flanagan said she felt peace of mind when her kid tested negative. Is that a good enough peace of mind? Can you go through that, please?
Well, I think the rapid tests have real utility just in the ability to inform the status of a child who's symptomatic, and I think the Lieutenant Governor said it exactly right. That's peace of mind. Do we recommend that every negative rapid test get a confirming PCR test? No. We're recommending that if you get a positive on a rapid test, following up to get a PCR test to confirm that is appropriate, because the PCR test might come back negative, and then again you've you've mitigated the need to, quarantine or isolate whole groups of people with close exposures. There are, I just want to mention, in addition to the over-the-counter Binox test, there's also a rapid test that can be administered in the schools by a health professional. There are other testing resources that the federal government has made available. They've got a national contract with Battelle that has a nasal swab test that's rapid in turnaround. So there are all kinds of different testing modalities. The bedrock ones that we've had here, the PCR lab testing, the nasal swabs through Vault. Remember, there are still Vault test at home kits as well that have a pretty quick turnaround. So we just want to make sure that as a state we're using all of those tools in the right combination. We do want to do some of this so-called surveillance testing, where we're testing groups of people who agree to be tested regularly, preventively, just so we can catch cases that way as well. So absolutely, the ability to have an at-home rapid test for symptomatic individuals is just a great addition. But there are these other tools that we also have available.
And will you try to make these at-home rapid tests available beyond just the schools? Right now, as I understand it, they're only available for schools in terms of free ones paid for by the state. Can you get them elsewhere, like the Vault setup?
Yes, I think that is our intention. And as the governor mentioned, with the Defense Production Act ramping up so that we could get a better supply, I'm sure many of you have had the experience of trying to get an over-the-counter test at a pharmacy, and they can't be found right now. They have been in use in long-term care, now in schools. We think the market will respond and create those tools for more people to use.
Commissioner, I wanted to ask also, are there any controls to make sure that districts are using these tests for their higher purpose? I mean, there could be a school out there with Binax tests they're using for surveillance, which isn't really doing a lot of good.
I think it's very important, and Commissioner Mueller mentioned this, that we are there as a partner and a resource to the schools to make sure that they are using them correctly, and that we can give them the technical assistance support that they may need to stand up a program such as they've done here. Yeah, it is important that people understand how to use the tests and what to do with the results of the tests, so we need to keep making sure that we're communicating clearly.
Time for one more today.
Sure. We'll go two. We got two.
Okay.
Some state workers testified at a Senate hearing today that they've been put on unpaid leave for refusing to do weekly COVID tests. One of them raised medical privacy concern about having to test in front of her supervisor. Do you have any concern about how this policy was rolled out?
Well, I can't speak to this one individually. I would let MMB address that. I do not believe that's correct, that they have been put on there. What we've asked state workers to do, as you saw United Healthcare announce today, and you've seen other major employers, is that for the safety of the workplace of workers who have to be back in the workplace, we're asking them to either be vaccinated or to test weekly, to make that choice. Workers who are not back in the workplace, that is not where they have to be right now until we move back in. So again, sure like a hearing on what's working, and out of 38,000 state employees, when the vast majority of them have done that, are protecting others, and they're out here doing their work to protect others, that would be more helpful. I'm sure, like in anything, there's some folks that are a little bit frustrated or whatever, but just to be very clear, I can't speak specifically. It is my understanding, and we can certainly get a verification on this, that no one has been put on leave for not doing this. We're, again, trying to work with folks, but I need people in those hearings to note the vaccine is safe and works. Testing protects others from you being asymptomatic and spreading the disease. You can be vaccinated and still contract a breakthrough case, and if you have underlying health conditions, that can be fatal. Why we would not be focusing on protecting people to be able to do that, and we are adamant, and have always been, about following all of the rules on health privacy. Again, so it's unsurprising if there's some follow-up we need to do on that particular case, but what I can tell you is the vast majority of state agencies are implementing this in a way that is making sure that state employees are there to serve, whether that is being an epidemiologist or whether that is when the snow flies that our plow drivers are not sick and have COVID and can get the job done. Those are the things that we're asking.
Governor, related to that, MMP identified something like 520-something employees who are not yet complying with that. And one of the concerns raised by workers is that there will be some attrition of those employees who don't want to comply with the mandate. How concerned are you about losing workers because of this?
Well, I'm concerned about losing workers, especially because what we're doing is to protect them. I would guess we lost workers when we said you couldn't smoke in the building anymore. I suppose there were some folks that left on that. This is about protecting others. I do worry about this. I'm trying to accommodate them, just to be clear. I think the best thing is to take the vaccine. There may be a legitimate reason you're not, and we certainly acknowledge that. And the simple thing is to do a simple test. We're having students do it. You'll simply know. Why would you not want to know if you were asymptomatic spreading COVID? The thought that you may spread it to someone who had an underlying health condition or a little one who can't be vaccinated yet, I remind you, we have children in ICU because they caught COVID. They got that from someone. Again, it's not their fault, but each of us can do something to alleviate that. So I do worry. I worry about in all areas. It's hard to find workers right now. We all know that, both in state government. But this is a reasonable request, is one that, as you said, out of roughly 39,000, we've got about 500, so you can do the math on that, of folks who are doing this. And we'll try and do our best to get folks there. I've continued, and you've heard me now for 18 months. I do not shame people. I do not get angry with people. I try to provide information to them. I ask them to not believe me. Go talk to their physician. Not to believe me. Go talk to someone who you trust who can give you good information.
Governor,
So,
quick,
sure.
two-part pandemic-related question.
And last one.
Do you want to stress to townships and cities that have not applied for that
Yes.
federal aid to do that by Monday?
Yeah,
And then I'll ask a follow-up right after that.
Yeah, it's their choice, and Tom's right that there was a deadline on this money, and townships can be pretty small. Minnesota has a fabulous system from townships to counties. These townships do an incredible amount of work. Township road, township bridges, things that they do. Many of them are small. They don't have grant writers, and this happens with schools too, the same thing. There's still money out there that they can apply for. It's a choice they have to make. The one thing I would say is that there are a lot of uses, and we asked Treasury for the appropriate uses of the COVID relief fund. I would think these townships could use them, and so I would encourage them to apply.
And then the second part, are you concerned about the $1.3 billion in the unemployment trust fund deficit that the state is running? Are you hoping Congress will act to help alleviate?
Yeah, I'm not worried. I do think it's a concern. The one thing I'm very proud of is our state finances are incredibly solid. We did run, there's about a dozen states, I believe, that are in the case, ran a deficit on the unemployment trust fund. There's a fix on that. We can have it'll be a long-term fix, could be. I think Congress may act on it, but we're prepared here in the state. I think there's some suggestions that would come up to be able to make that work. But right now, I'm confident that we'll be able to handle that. So.
Governor, nationally we're seeing COVID numbers decline. That's not the case in what we've seen in Minnesota recently. Do you have thoughts about why that is and what?
I might let Jan. Yeah, it's a good question. And this has happened every time. If you go and compare state epi curves, ours does look a little different. In many cases, it looks different in a very good way, especially considering, you know, the territory we're in the upper Midwest. But what we've also seen is a phenomenon where we don't quite climb as quickly or on pace with other peer states, and we also don't decline as quickly. What we end up is that a lot of these states, and we've had it a little bit where it's a very jagged, you know, Missouri and some of those we tend to look more like this. And so Mayo Clinic, who we get in touch with, are still saying it's looking like that pattern will hold true. We're looking, again, I don't want to speak out of turn because Jan may know a little bit. We're looking at the next couple weeks, but it may go. But there's also variables in this. I worry, to be very honest, that it gets cold very fast. Just to be clear, this is I wake up in the morning not just because it's nice and to be out here. I know more kids and more people are outside for longer periods of time, and COVID rates go down. So the minute we've seen this happen now, we know enough about it. If it gets cold, we go back in sooner, especially when Delta is still out there and hasn't peaked yet. I think one of the things is